Siapa present?
Saya ada. Saya. Lutfi.
Present dulu ha.
Ya. Okay, Assalamualaikum warahmatullahi wabarakatuh, everyone. My name is Lutfi, and I'm going to present a chronic case today. So, this patient is Mariam, 6 years old, Malay girl, with underlying frequent relapse of steroid-resistant nephrotic syndrome, referred from KK Kuala Ibai to HTAA due to facial puffiness for 4 days. First of all, the history of this patient was taken from her mother at the first day of admission on 3rd January 2019. She was apparently well until her mother noticed facial puffiness, mainly on both cheeks and around eyes 4 days prior to admission, and it was non-tender. Her mother also noticed that her abdomen slightly distended. 2 days prior to admission, the puffiness, the abdominal distension had worsening with additional bilateral leg swelling and also swelling at perineal area without any precipitating factors and also relieving factors mentioned. She was also no history of fever, no history of allergy, and also no history of trauma. Her mother also complained of increase of weight, but she denied on any episodes of nausea, vomiting, abdominal pain. She also noted that Mariam's urine was foamy, like bubbling, berbuih-buih in nature, but no pain during maturation, no blood, no foul smelling. On 4th day after onset, the swelling, the abdominal distension has not reduced. So that's why she was brought to KK Kuala Ibai. But I'm not sure what happened at the KK Kuala Ibai, but after that, she was referred to HTAA for further investigation and also management. Upon further questioning, it was not her first time experience this. The first admission was April 2015. This case, this admission was on January 2018. So it is like 3 years, 3 years ago, when she developed same problem, facial puffiness associated with leg swelling and also abdominal distension and frothy urine. And she had been diagnosed as nephrotic syndromes, and multiple admissions afterwards occur due to relapse. But the first relapse was happened on June 2015, about 2 months after the first admission. And there was more and more episode of relapse afterward until she developed steroid resistant towards steroid. So that's why she was given cyclophosphamide instead. Therefore, due to the steroid resistant, so she had undergone renal biopsy to find the cause of this nephrotic syndrome on December 2016. And the result shows she had nephrotic syndrome secondary to minimal change disease. And her mother also mentioned that for only 2018, she had admitted 4 times due to relapse.
Bila your ni nampak muka Lu Hadi kan, Lu present kan?
Yep.
Oh, okay.
And the last admission in December 2018 due to SBP, spontaneous bacterial peritonitis, which is the most complication of nephrotic syndrome. And now she was still on prednisolone, even she did not respond well to steroid. On systemic review, generally she had gained weight, but no fever, no loss of appetite. And also under genitourinary system, she had frothy urine, but no hematuria, no dysuria.
Then why this one HOPI kan?
Yep.
Why you put systemic review?
Because I have already finished the HOPI.
But the hematuria is a HOPI or systemic review?
Right now, systemic review.
My question to you, HOPI, hematuria, history of hematuria should be in HOPI or systemic review?
On systemic review.
Why systemic review? Don't you think that hematuria is important part of history in this case?
Yes, because to rule out the nephritic syndrome.
Or nephritic, the severe type of nephrotic syndrome.
Okay.
So why you want to put it on the systemic review? Why?
Because I think I want to rule out that.
Yes, I understand. But don't you think that history of hematuria, history of proteinuria? I ask you, how you know proteinuria from the history?
Frothy in nature.
Are you the mother say proteinuria? Then how you know it's proteinuria? Did the mother told you it's proteinuria?
No.
Mother didn't told you proteinuria. Why you conclude it's proteinuria? One, unless you told me the mother test the urine at home is protein.
Oh, urine dipstick.
Second, how do you know or not? HOPI is anything positive and negative history related to the
Chief complaint. Yep.
So it is related chief complaint tak?
Apa tu?
Is hematuria related to chief complaint or not?
Hematuria no. Because chief
Why you
complaint
talk
is
about chief
puffiness.
complaint?
Sorry, sir.
You mean that nephritic don't cause puffiness?
No.
AGN doesn't cause puffiness. Acute glomerulonephritis with hematuria doesn't cause puffiness.
I think it may cause other.
Then why not in HOPI? Why it is in systemic review?
Oh, okay. I see. So I need to mention earlier there.
You see, it's matter need or don't need. It is matter where is it appropriate. Anything related to chief complaint should be in the HOPI.
Okay.
Either positive or negative family, either positive or negative history. Understand?
Yep.
Okay,
Okay, continue. I'm continue with other system, the system on systemic review. Where the system show unremarkable findings like in abdominal system, no diarrhea, in CVS, cardiovascular system, no palpitation, no stenosis. On respiratory, no shortness of breath, no noisy breathing.
You mean shortness of breath not related with puffiness?
Not related.
Related or not related?
Shortness of breath.
If the chair developed pleural effusion, would the chair got shortness of breath or not?
Yes, because
So
of the
where
pleural
should
effusion.
So where the symptom of shortness of breath should be? In the HOPI or systemic review?
Should be in HOPI.
Continue.
For the system, hematological system, there is no bleeding tendency noted. For neurological exam, no headache and no seizure. For musculoskeletal system, no bone pain and joint swelling noted, and also there was no rash on skin. And for her past medical history, she had multiple admission before due to frequent relapse steroid resistant.
Why it passed?
Past medical history.
The frequent admission to relapse, due to relapse. Is it related to chief complaint or not?
Yes, doctor.
Yes.
And then why you go to the past medical history? It's related to the chief complaint. Don't you think it's important?
Yes, as underlying problem.
Yes. Why it become past medical history?
Actually,
You mean that the nephrotic doesn't happen again? You think nephrotic is a disease of once it happened, nothing happen in between.
No, there will be relapse and remission.
So where it should be?
HOPI.
Because it is part of the patient disease.
But Doctor, I have already mentioned on chief complaint lagi with underlying frequent relapse. I see.
Frequent relapse. Tapi you want to tell us the history of relapse, is it?
Yes.
Amitansinis semua. So where should we think?
HOPI.
HOPI because it's related with the child problem. Itu history of present illness. You think that what the present illness of this case?
Facial puffiness, abdominal distension.
Facial puffiness illness ke? Facial puffiness is a symptom. It's not the illness. What the illness of this case?
Nephrotic
Syndrome.
Yes, the illness of this case is nephrotic
Syndrome.
The illness of this case. Anything related to the nephrotic syndrome should be in the
HOPI.
Okay, I give you time to relax 5 minutes, then you will present again.
Okay.
Understand? You redo back the history.
All right.
Okay. 5 minutes, you redo back the history, you present proper HOPI. Okay.
Okay, Doctor.
Ready dah? Boleh?
Okay, Doctor. Try.
Boleh dah, okay, present balik.
Starting from HOPI, Doctor. Okay. For HOPI, she was apparently well until her mother noted facial puffiness, mainly on both cheeks and also around eyes 4 days prior to admission. It was bilateral and non-tender. Her mother also noticed that her abdomen slightly distended. Okay. 2 days prior to admission, the puffiness, the abdominal distension had worsening with additional bilateral leg swelling and also has swelling at perineal area without any precipitating and also relieving factors mentioned. She was no history of allergies and also trauma, and she was no history of palpitation and also shortness of breath, and also no bleeding tendencies noted. Her mother also complained of increase of weight, but she denied on any episode of abdominal pain, on diarrhea, on nausea, vomiting, and also constipation. She also noted that Mariam's urine was frothy, was foamy in nature, but no fever, no pain during maturation, no blood, and also no foul smelling. On the 4th day after onset, that swelling, the puffiness has not reduced. So that's why she was brought to KK Kuala Ibai and then was referred to HTA for further investigation and also management. Upon further questioning, it was not her first time experiencing this. The first admission was April 2015, about 4 years ago, when she developed facial puffiness associated with leg swelling and also abdominal distension and also urine. And at that time, she had been diagnosed as nephrotic syndrome, and multiple admission afterwards happened due to relapse. And first relapse was happened on June 2015, which was 2 months after the after the first admission, and there were more episodes of a relapse afterwards until she developed resistance toward steroid. Then that's why she was given cyclophosphamide instead. So at this condition, she had multiple admission. She had frequent relapse of steroid-resistant nephrotic syndrome. And then, due to steroid resistance, she undergone renal biopsy on December 2016 and was diagnosed as nephrotic syndrome secondary to minimal change disease. And her mother also mentioned that for only 2018, she had admitted 4 times due to relapse steroid resistant nephrotic syndrome. And last admission in December 2018 due to spontaneous bacteria peritonitis, which is the most common complication in nephrotic syndrome. And now she was still on prednisolone, even she did not respond well to steroid. That's for HOPI, Dato. Is it okay, Dato?
Apa?
That's for
Finish
HOPI. I've included some systemic review that I have said just now.
Lokman, any question? Lokman, any questions? Huh?
No question so far, Doctor.
No question. Can you tell me how bad is it the relapse, this relapse? One moderate or severe?
I think it can be classified as severe, as
Why you say severe?
it has lasted for 4 years since the first.
You understand the question tak? My question to you is for this relapse, which is how many days ago?
4 days.
4 days.
4 days ago, is it? Okay. How bad is it?
I think it's moderate
Why you say moderate?
because it doesn't develop hematuria, as the mother mentioned.
Hematuria, I can tell you, why is it hematuria is the sign of severity of nephrotic syndrome relapse?
I'm not sure, Doctor.
You're not sure? Why are you not sure?
Because I've just read, it said that hematuria is not common in.
Yeah, it's not common. But I didn't ask you about nephrotic syndrome. You listen to the question properly. Do you think this relapse? Understand this relapse? With all the signs and symptoms you have heard when Hadi present just now. Do you think it is severe, a mild, moderate, or severe? The relapse. Then furthermore, if you don't know hematuria is sign of severity, why you want to mention hematuria? Don't you think you look funny, you know? You present something you don't know.
I think it's moderate.
Why you say moderate?
Because of the it has developed generalized edema.
Why can't it severe?
So can be severe also.
So which one?
I stick for severe. I think it's
Why
severe.
you say severe?
Because it has manifested into generalized body.
Generalized edema. You mean that in moderate you have generalized edema?
No, Doctor.
Only a severe you have generalized.
I think it can be more mild instead of generalized.
Pardon?
I think for moderate, I think in only a few parts of the body will develop edema.
Where?
in the face, in the lower extremities. For this patient, it has developed until the perineal.
So you think it's severe? Budak tu macam mana? Aktif jalan semua ni semua? Hadi?
Yes, doctor.
During that time dia cerita he can still walk, is it?
She looked conscious, active and comfortable on bed.
Say how you say severe? The child can walk around ni semua with the edema.
Sure, doctor.
Sorry, doctor, can I try?
Nanti dulu.
I think if I classify the patient solely on the edema, I think the edema is very serious, but it does
What
not
you mean
affect.
edema very serious? Serious until he cannot walk, but he still can run. You think that is it possible people develop edema until cannot walk?
Yes.
But this child can walk.
So it is moderately or mild.
Why you say moderate? Why cannot mild?
Because the patient is clinically well.
But the child got jelas edema.
But it doesn't affect the patient.
How you know?
Well-being.
How you know?
The patient look well and active.
How do you know? Do you ask that question?
No, Dr. Lutfi just said just now.
Who asked the question? You asked the question.
No, doctor.
Who asked?
Doctor asked.
Why can't you ask that question? Is it so difficult to think about that?
No, doctor.
Then why can't you ask any question about that? Don't you think you're not curious to know about that? To tell you how a patient is? You dengar history tu, you dengar macam tu je. You tak fikir pasal inside your brain tu, what is it, how good the patient, how bad the patient is, how severe the patient is. Tak, you dengar je.
No, doctor. I thought Lutfi will tell us more.
Okay. If you have something, you think the history clear ke? If I say to you this is not clear, what you say?
I would ask for more explanation on the patient.
Then? Why don't you ask the explanation?
Can I ask now? Ask to Lutfi. Lutfi, can you tell us more on the patient, how the patient is doing in the hospital?
Can you be more specific? Like, can the patient run? Can the patient eat? Be more specific. It tells us that you're looking things very specific.
Okay, I try again. Lutfi, can you tell us more on the patient, especially if the patient is doing well, such as she's a kid? Does it can go run around and like active with her mother, smiling or not?
Okay.
Shows that the patient is doing well.
Okay, I understand the question. Okay. Upon physical examination, what I found is she looks conscious. Okay, she looked conscious, she looked active, and she looked very comfortable on bed. Okay, and she appear no cyanosis, no failure, no jaundice, and also.
Asma, you want to ask? Asma.
How about her her general appearance? I mean, like, is there any dysmorphic features or not?
Okay. There is no dysmorphic features. There is no Cushingoid appearance like moon face. That's it.
Emma,
Yes, doctor.
anything you want to ask?
Why is there any periorbital edema in this patient? Lutfi?
Apa? Why
Why?
periodema?
Why there is periorbital edema in this patient, Lutfi?
Oh, you should know already lah. This is relapse. Of course, the periodema.
Special
You
convenience.
you think why is it people develop periodema?
Because of
In necrotic.
hypovolemia.
Then why you have to ask the question that you know
Okay,
the
okay.
answer?
One more question. Why does in this patient the doctor prescribed prednisolone even though the patient is resistant towards steroid?
Okay, good question actually, but
No. Because you're reading from the people punya other notes, is it? You don't know the answer.
I know the about the problem. Like,
But do you know the answer or not? I also don't know the answer.
not sure.
Huh?
Not sure because
Not
initially it
sure.
was sensitive and then resistant and then convert to cyclophosphamide, and then at the same time she also given
Fatin, anything?
prednisolone.
I do have a question. Is the patient come with hydration?
Pardon?
Good. Is the patient come with good hydration status or dehydrated?
There is no sign and symptoms of dehydration. No sunken eyes. Capillary refill time normal, below than 2 seconds. And
Okay,
so on.
Fatin, Najihah?
I want to ask regarding the developmental mileage of the patient.
Developmental milestone. Okay. She was appropriate. The developmental history for this patient was appropriate for her age. That's all.
Aliza?
I want to ask, are there any complications from the nephrotic syndrome, such as associated infection or hypovolemia, or even evidence of thrombosis or even hypercholesterolemia?
Okay, I think if you know the patient has complication or not, we must look to the clinical features of that complication itself. Okay. First one, you see hypovolemia. So when hypovolemia, the patient may have hypotension, may have cold very freeze, but it's not. But it is not. It's not that case in this patient. And also, the second complication is spontaneous bacterial peritonitis. She already developed on 2018, and then was admitted at that year to cover the spontaneous bacterial peritonitis infection. And then the third one, thrombosis. There is no hematological problem, but I think we must look further investigation on this complication. So as for now, the only complication that she already developed was spontaneous bacterial peritonitis (SBP).
Amani?
I think most of the questions are already asked, but I think I want to ask, does she have
Answer the question.
any
100 questions to ask.
problem with her cardiovascular system?
Okay, her cardiovascular system, like I mentioned before, she doesn't have any any cyanosis, any shortness of breath, any tachycardia in HOPI. Yeah, I mentioned before. There's
Why you ask cardiovascular system? What you think cross your mind?
Because heart failure can also be one of the cause of edema.
For 4 years.
Okay.
4 years.
No.
What the sign of heart failure you want to ask? The symptom of heart failure you want to ask? Is the child, how old is the child tadi?
For 6 years old.
5 years old. What is symptom?
Shortness of breath
Lagi?
or increase.
Sound breath lagi apa?
Doctor, I take back the question.
You take back the question. Now I asking the question. You cannot down the way. I asking you, in 5 years old child, what is the sign of heart failure? Shortness of breath satu. Lagi? Okay. Can you Google sign of heart failure? Hanum, any question to ask? No, any. Google the sign of heart failure in children. Hanum?
Can I know about the nutrition of this child? Well, what they eat, eat or drink?
Okay. Her nutrition status was overall good and normal. She was exclusively breastfed until age of 6 months. Then after that, her mother began to introduce soft food like porridge after that. And then at the age of 2 years old, she had mixed diet with formula milk and also porridge. And then she stopped. Drinking milk at the age of 4 years. And then after that, continue to consume the normal food like that.
Okay, Amani, anything? Sign of heart failure apa?
Shortness of breath, fast breathing, feeling more tired than usual, and also poor growth.
Apa?
Poor growth.
Pointer apa?
She need to take frequent rest while doing the activity.
Symptom of heart failure. Itu dia, you cari apa tau?
Symptoms of heart failure. Symptoms of heart failure.
Can you Google symptoms of heart failure? You Google tak?
Yes.
Symptoms of failure. Dah Google dah?
Dah.
Apa dia tulis tu?
Fast breathing.
Lagi?
SOB.
Lagi?
Feeling more tired than usual. Need to take frequent breaks while playing.
Lagi? What causes? Decrease effort tolerance. Lagi?
Swelling of the leg, ankle, eyelid.
Edema lagi?
Sweating.
Lagi?
Lack of appetite.
Lagi?
Nausea or vomiting. Nausea or vomiting.
Lagi? Ada more important sign, symptom. Tak dengan otopnya. Dia tak tulis otopnya. Ada tulis tak?
Tak ada, tapi
ada. Nanti lousy lah you punya website tu yang you cari tu. Lousy, tak ada otopnya. Okay, did the patient have all those things? You free, the patient tak?
Swelling of the leg, ankle and
No.
You only have apa? Edema saja.
Yep.
You don't have the other symptom.
Kalau cardiovascular system, there is no positive. There is no abnormality. There is no negative.
The question you listen or not? The question dia punya answer tadi. You list balik. The sign is symptom to the symptoms. List balik. Dia dengar elok-elok. Okay. No money list balik.
Okay. Fast breathing.
Lagi.
Shortness of breath. Feeling more tired. Need to take frequent rest. Fall asleep when feeding or becoming too tired to eat. Lack of appetite. Swelling of legs, ankle, eyelid, face or abdomen. Nausea or vomiting. Abdominal pain. Cough or lung congestion. Sweating. Or apnea.
Ada ke semua tu?
No, doctor. Unless swelling of leg.
Swelling of leg. What you call it? Ankle edema. Other than ankle edema, there is no other
symptoms.
Tak boleh tanya soalan macam tu. Nampak tak lebih intelligent tanya macam tu? Nampak tak? Dia tanya about the symptoms. Ada tak budak tu autopnia, tidur 3-4 bantal? Ada tak budak tu decrease effort tolerance, unable to will play saja dia become more tired? Nampak tak macam lebih intelligent kan? Ada tak budak tu nampak tachypnea or breathless? Susah tanya soalan tu. Difficult. Then Fahadi can answer, actually it is what? There's none of that symptom except that edema. So it gives you clue, is it? Looks like the child is not having heart failure. You jawab soalan apa? Jawab intelligent. Najihah, tell me the apa tu? The essence of the case.
Sorry, doctor.
The essence of the case. What this case all about?
Relapse of steroid resistant. Relapse of steroid resistant.
Apa?
Do you mean to summarize the case?
No, I asked you the essence of the case. What this case all about? So nampak mata you buka tutup, tertutup, saya nak tertutup je. Okay, before you go that, I nak tanya Alisa, how you think the severe relapse this time? How severe the relapse this time? When you listen to his history, how severe the relapse do you think?
You mean how severe the relapse is?
You got, when your severity, you got mild, moderate, and severe. So what is your argument on your opinion? When you give your opinion, what's your argument of your opinion?
In terms of the severity of the illness itself.
So you listen to me. When you have the question, to listen to the question. So my question to you is that you have listened to the history, you have nothing to ask. Do you have anything else to ask? No more to ask. Do you have anything else to ask?
I think at the moment, no.
No, okay. I mean, if you don't have nothing to ask, it's either you know everything or you know nothing about the case. No. So listen to me. You listen to the history. How bad the relapse is?
I think the relapse is quite bad.
Why you say it's bad?
It's because the patient is first patient is already developing a complication such
Moderate, bad or severe? You think severe lah? Eh? Mild, moderate or severe? You think severe, moderate?
moderate.
Moderate. Okay, why you think it's moderate?
I think it's moderate because the patient is still looking well and can still like communicate with her mom, and there's no signs of
If you think it's severe, what the symptom do you expect the child going to have?
hypotension.
How to present hypertension? There's not symptom, you know. My question to you is symptom.
Okay, the symptoms would be patient would be unable to communicate, unable to move.
If you have hypertension, what happened to you?
Low blood pressure.
What happened to you?
So we'll be tired all the time.
Lagi?
Difficulty in breathing.
In hypertension. Tak boleh imaginative, tak imaginative lalu. Hypertension, it means not enough blood goes to the brain. Result in the can be hypoxic to the brain. What happened to hypoxic? The child can be lethargic, weak, drowsy, headache. Even the child can syncope. When try to sit for stand syncope, cannot imagine that. Unable to just take imagination only. What are the sign of severe relapse? You think it's severe? You're talking about why the child hypertension? You're talking about hypovolemia. Okay. What about the other sign?
Any concurrent infection?
Sign of severe relapse. That's why you see you are unable. The weakness of you all is you have learned already nephrotic already. You learn nephrotic already. You have not understand the disease already. You know that one they can hypovolemia. Second, they can have severe edema. The fluid can go into the third space cause edema almost everywhere, is it? Severe. From the lung effusions where they can present with shortness of breath. Go to the very bad edema abdomen, can distended, it can cause shortness of breath. Even distended abdomen so bad with distended of ankle edema, the child has difficulty to moving around. We call condition we call anasaka. Tak boleh imagine. Tak boleh. You are unable to connect between the physiology and the clinical. That is how you connect between the physiology and the clinical. The clinical presentation is sign and symptom. If the patient develop shortness of breath in nephrotic syndrome, there are physiology can explain that. What the physiology can explain that? If the child develops severe fluid effusion, result in difficulty in breathing, or severe abdominal distension, impair the diaphragm, result in difficulty in breathing. That is the physiology. Itu payah tulis benda ni, bukan imagination dia. How you imagine things. how you connect between the sign and symptoms, and then how you connect. Tak dapat nak buat. So you baca dengan clinical tu two different thing. Then rugilah you all. Can you able to connect between these two, and your life become easy. Najiha, what are the essence of the case?
The patient came with history of relapse steroid-resistant nephrotic syndrome for about from 2015.
You think about the case. You think about this case and you tell me what do you think, what the thing come to your mind about this case. Anything? Anybody want to try? Anybody want to try? Tak ada orang berani. Nak try tak?
Yeah, I can try.
No harm what? I'm not going to shoot you to the. You still alive after trying.
Yeah. So whatever I understand the chief complainant also from the history of presenting this, that within a couple of years from 2015,
okay,
I understand that
the essence of the case only in one sentence.
Okay.
One sentence saja.
Yeah. Due to the ineffective or non-responding treatment of prednisolone, this caused relapsing of nephrotic syndrome because she developed steroid-resistant nephrotic syndrome. One sentence.
One sentence. 7 words only.
7 words.
Lokman, let's try.
A 6-year-old female having a nephrotic syndrome.
Okay.
Due to relapse.
Guna dah hampir 80% dia tu. Cuma you kena modify word sikit. Anybody?
Can I try again, doctor?
You try.
Okay. 6-year-old female having a relapse due to steroid-resistant nephrotic syndrome. We started 4 years ago.
Okay, 80%. Anybody want to make it better? The words become more catching your brain. No, it catch your brain to solve problem. Anybody?
I want to try that. 6 years old girl having frequent steroid-resistant nephrotic syndrome with history of multiple admission many years ago, 4 years ago.
What is having now? What the problem now?
Facial puffiness. Facial illness apa?
Currently, what the problem is having now?
Facial puffiness.
Yeah. What facial puffiness due to what?
Due to nephrotic syndrome.
Due to nephrotic syndrome, what we call that? The child is having what now?
Generalized edema.
Child is having what?
Generalized edema.
Yeah, why the child develop generalized edema?
Due to hypoalbuminemia.
What do we call that? The clinical condition. Kau tak berani nak cakap lah.
Anasarka. Anasarka.
Not yet Anasarka. The girls tak berani lalu semua takut kena you after that you going to die the girls. You tak boleh nak cakap apa because you worry you going to die after this. Salah cakap you die. Or you very painful salah cakap. Is it?
No.
What you think the child is having now? You already told me the child is having
Frequent relapse.
What the background of this child? This child.
Nephrotic syndrome.
Nephrotic syndrome. So the essence of this case is, this is how old the child?
6 years old.
6 years old girl or nephrotic girl who are having
Infantile.
Yes.
who are having
Facial
what is
puffiness.
she having now?
Facial puffiness.
Due to what?
Due to relapsing.
We call relapse.
Syndrome.
So this is 6 years old nephrotic child who are having apa?
Facial puffiness due to relapse.
Satu word saja, who having
Relapse.
Why you so difficult? It is a 6 years old nephrotic syndrome who has relapsed. You don't think it's relapse, you think something else. You think it's heart failure. You think it's a liver failure.
No.
You think this child is having? What is child having now? Relapse. Is it?
Relapse.
So what the next thing come to your mind?
Treatment isn't working well.
Huh?
The treatment isn't working well.
That is the answer of the questions. What the clinical questions come to you? This is a 6 years old girl who are having relapse, who are 6 years old nephrotic girl who are having relapse. What the clinical question come to you? The questions.
Cause of nephrotic syndrome.
Okay, let's say you don't see you try. Let's say you see the case first time or you try to figure out the child coming to you in other scenario, other patients. What the thing come to your mind?
Would it affect her growth?
Yeah, that is the effect in terms of quality of life. The clinical question to you, one word saja. Start daripada words W.
Wait.
Ada dalam mind kau takut nak sebut tu je.
Wait.
Wait.
Why?
Why what? Why?
Why does the relapse happen?
Having relapse.
Come to you, why this child develop relapse?
Yeah.
What is the possible answer?
Steroid resistance.
Due to steroid resistance.
That one is probably the child is the disease, the disease of the natural disease of the kidney itself. What are the possible answer?
The patient didn't adhere to the drug.
Patient
tak makan ubat.
Probably patient not compliant to medication lagi. Apa lagi?
Genetic, Doctor.
Genetic, or talking about the natural history of the disease itself. Some people, some child got simple nephrotic, some people child got complex nephrotic. We already discussed about that. What's the possible cause of relapse? Where you got all the knowledge, possible cause of relapse, the history of the disease, where?
Lifestyle.
Huh? Where is it?
Maybe due to the long-term usage of steroid.
Okay. Where you get all the info you want to answer the clinical questions.
Drug history.
It still tell you when you want to clarify things that you have inside your brain, the knowledge you have inside your brain. Where you get all those knowledge. You get knowledge tiba masuk ada dalam otak you.
Due to
Suddenly you
physical
know
examination.
Pardon? Where you get the knowledge?
Physical examination and also lab investigation.
That's what you answer the clinical questions. The question why the child is having relapse. Why you read the book?
To get knowledge.
To gain knowledge.
For what? Pass exam. How many of you really read the book because you want to solve patient problem? How many of you here read the book because want to pass exam? Cakap dengan truth, dengan benar-benar ikhlas.
Both, Doctor.
Oh,
InsyaAllah.
very diplomatic answer. Yeah. Yeah, unable to diplomatically answer. That's why you read your book. You want to solve the patient problem. The patient problem is this nephrotic child who having relapse. So you how are you going to proceed furthermore if you don't have knowledge? I ask you the questions. What possible cause relapse? You don't know. I mean that you have inadequate knowledge to solve the patient problem. Where the knowledge come from? Book and
God.
Book and see where do I ask Fatin just now. Give me the symptom of heart failure. How long he took her to get the answer? Berapa lama you ambil masa, Fatin?
I think it's Amani.
Few minutes kan? Where you get the knowledge?
Website.
Pardon?
Google.
Where you get your knowledge?
Google.
Tell me what's that not there in Google anymore?
Doctor. Doctor, can the relapse because of the immune system is not?
Answer my question dulu. And ajar you suruh fikir. And to search for the knowledge. So where you can search the knowledge from? Inside the
book.
Book lagi?
Internet.
Internet. Cuba you Google causes of relapse of nephrotic syndrome in children. Sure, there will be the answer already, isn't it? List you all the answer already. It can be a poor compliance, severity of a disease, UTI, apa lagi, wrong medication, inadequate medication. Severity of illness, all inside the internet. So you pakai internet you untuk apa? Nak solve special problem ke atau nak for your social life? Mana satu?
Solve the problem.
Ya, bukan social life. Ya, betul ke? To solve special problem. How many percent of internet you use for your search or knowledge? How many percent you use for social life? Tak pernah fikir tuan muhasabah. How much you wasted your time or not wasted your time. Social life tu penting kan? Yeah. So what it means is that that's how. So okay, the next question is if the history present by Hadi tadi answer all those questions. Answer the question of why the child haven't relapsed. Ada?
No, doctor. Not answering.
Not answering. Dengar tu Hadi criticize you. Answer lah. It's not my history. I just baca je.
Which one?
If I kelak the question will be different. You can see because somebody else kelak dia cuma baca orang lain history. No choice. Sebab dia same punya pasal. Ya. Hadi, same punya pasal you kena kelak this case properly. You think you can kelak better?
Allah.
Present better? Okay, that is the idea for today. Itu dah banyak tu.
Okay.
Actually, I have ada satu lagi lecture, lecture. So the idea for today is you have to understand first the chief complaint. Second, what is HOPI? When you present history, if you are very confident of the history, you present in chronological order. If you're not confident, you can present like this. But if you are confident, that some of my students, they say, the problem start with the child age of 2 years old when started presenting like this, and then child was diagnosed to have nephrotic syndrome and was started on medication. And then for the first relapse 2 months after that, completed medication, initially respond to, in this 1 year got 4 relapse, the second year got 3 relapse, and then and slowly the child also didn't respond. At the third relapse, the child is unable to, the relapse occur, the child on steroid, and then after that the child not responsive to the steroid. Usually child relapse because of UTI or what, because of stop medication, decrease of medication, and so on. So you know the history or not? Don't you think it's nice? You see, if you present history nicely, orang yang dengar terpegun, tahu tak? Sonok dengar. And they can, sonok dengar. This one thing that, remember in anything related to the chief complaint or illness, HOPI illness will come to under HOPI. If the child, let's say, got appendicitis, which will be under HOPI or past medical history. In this case,
Past medical
history.
Past medical history. No, it's not related at all to the nephrotic syndrome. So you pass medical history. The second thing is that you must understand what the issue of the question in this case. Look, this is asthmatic child having acute exacerbation. This is the child who got shortness. The child is 3 years old child who having shortness of breath for 3 days. This is the child who are having diarrhea for 3 days. And you list all the costs, everything what you do. That's where your reading knowledge comes. What is the cost of shortness of breath in 3 years old? What is the cost of edema in 4 years old? What is the cost of relapse in a nephrotic child? What is the cost of shortness of breath in exacerbation in asthmatic child? All is then you have to use your knowledge. After you, if you don't have knowledge, you cannot. Difficult you want to or difficult you want to solve the problem. You use your knowledge. From there, you try to your clerking, your examination is try to help to solve the patient problem. And you know the knowledge now at the tip of the finger. It's not like you have to go. Last time you have to bring the thick book, have to go to library, cari ni semua. Not even the journal also. Many journals are in the internet. You can find the knowledge at the virtually. Simple saja. Susah ke clinical ni? Difficult. Itu je clinical. Susah.
Takes time to adapt lah.
Take time to adjust. And then
How you going to get the skill?
Practice.
try to think hard.
You have to
Practice.
clerking with many patients. The more you clerk the patient, the better you're going to be. That's all. Ada magic bullet. So you have to adapt lah. Jumpa adik you seorang, adik you 4 tahun, yang 10 tahun tu kata dia adik-adik boleh jadi asthma patient tu. Berlakon je asthma patient. Kakak nak clerk, nak clerk. Boleh. Kena settle usul baru kes buah gula. I don't know how to help you all because current situation. So we do our best lah. Because when I teach you all, if you don't practice what I taught, after a while it just jadi macam abu macam tu je. You have to practice what you know in order to make it part of you. Okay, any question?
Doctor, I have a question. For past medical history, it says that the past medical history, we put the past admission to the hospital, right? But for some cases, like in this patient, the past hospital admission is also including the relapse due to the nephrotic syndrome. So, which
what you say is past? What past mean? Don't you think that you don't the admission is past, but the history is the illness is
recurrent.
Illness is current.
So we don't have to include in the past medical history anymore. We just put it in the HOPI.
Yep.
Right.
Because the admission is past, but the disease is current, and HOPI is history of
presenting illness.
Illness.
All right. Thank you, Doctor.
Okay. Any other question?
Doctor, I want to ask, untuk chief complaint kan, some chief complaint that I had read, sometimes they got direct, macam contoh Mariam 6 years old, Malay girl, facial puffiness for this dah. But sometimes she also include the past medical history, like and the past. I think I mean the illness like this patient, like this patient has.
You see, you chief complaint is set a symptom. What you tell this is 6 years old boy who having nephrotic for the past 4 years, who come with chief complaint of facial puffiness for 3 days. The chief complaint is what? Facial puffiness for 3 days. It's not the chief complaint is you just mentioned this is a known case of nephrotic. Known case of nephrotic is not a chief complaint. It's just a statement. 4 years old who have asthmatic boy who chief complaint of shortness of breath for the past 2 days. Noisy breathing or wheezing for the past 2 days. So the chief complaint is the shortness of breath and wheezing, not the
underlying problem.
Asthma is just a background problem. It's not chief complaint. The chief complaint is symptoms that bring the child to see you or admitted to the hospital. That is chief complaint. If you patient you don't know have asthma, this is 4 years old. But if child is asthma tapi having abdominal pain for 4 days, this is a 4 days old child who having abdominal pain for the 4 days. In past medical history, you can see the child is also known to have asthma, which on treatment because it's not related with the chief complaint. Okay, because we're not going to discuss of asthma of the child in this case. We're going to discuss the abdominal pain because the problem of this child is having what? Abdominal pain. Your job is to solve the problem where the child was brought to see you. If the mom brings you the child because the asthma, then you discuss the asthma case. If the child was bring to you to see you because of abdominal pain, your job is to solve the abdominal pain. Even if the child got asthma, because your job to do because the patient was brought to see you because of abdominal pain. So your key guidance to the case is the chief complaint. You see, you must get the chief complaint because nobody suka-suka bawa anak dia jumpa you atau datang jumpa you. Datuk, saya saja jumpa you suka-suka saja. Ada tak? Ada. Because if they come to see you, mesti ada sebab. Saja nak jumpa, nak minum kopi dengan you, nak socialize. Ada. Patient come to see you that we're not going to call them patient. We're going to call them friends, duduk kat luar minum kopi sebagainya. But once the patient come to see you as a doctor, they have something why they want to see you, and that is the chief complaint. Okay.
Okay.
Anything else? Okay, finish. I tak semayang lagi. Okay. Okay.
Thank you, Doctor.
Thank you, Dato.
Thank you, Dato.
Thank you, Doctor.
Kira kita macam mana ni?
Dah.
Habis dah
Separuh
Dari-
tak sampai.
Tak tahu, Doktor.
Doktor pun ada.
Dia cakap untuk ada meeting.
Doktor ada meeting kan?
Tak ada apa? Ada kelas.
Ada kelas.
Kelas yang year 5. Kelas. Yang year 5.
Lepas tu kita ada session lain ke yang ada?
Jangan tanya.
Clinical.
Jangan tanya.
Masuk hospital nanti.
Doktor takkan cari. Doktor takkan cari.
Itulah.
Good job, guys. Good job.
Good job.
Marah.
Dul tanya first. Dul. Baik Adul.
Dul muka macam hilang darah tau.
Nampak Adul. Obvious.
Cool.
Ekor ni perlu tak?
Kena buka aircon next time.
Atau kena buka aircon. Good job, gang. Good job. Luffy. Good job.
Luffy baik.
Backup banyak.
Sorry, we tried.
Yeah, we tried. Absolutely.
Okay, gang.
Bye.
So tanya. Tapi
Ya.
Yeah.
Sorry Amani.
Tunggu dia cakap dulu. Dia cakap dulu. Okay.
Ada.
Kalau dia tanya macam mana?
Dia tanya baru jawab. Tapi tak rasa doktor akan cari.
Ya tak apa, mana-mana nanti aku tanya korang.
Left kan, Pete?
Baik, good job.
Bye.
Bye.
Jumpa Nicole. Bye-bye.
Bye-bye.